the end. Now, as the chair of the Global Leaders Network, I want to thank everyone who's been involved in this critical initiative. And by your mere presence here and the work that many of you continue to do in your various positions and organizations, you are helping to move the needle. But we need to do much more to save the lives of millions around the world. And we can, I believe, reduce poverty and inequality. We can, I do believe firmly, that we can improve productivity and develop economies and transform communities across the globe. By improving the health outcomes for women, for children and adolescents, we will be taking steps in that direction. So if we all act together, but not only act together, but we need to raise the level of awareness and consciousness, because quite often you find that many people are not so aware and well conscientized about the alarming statistics that we saw in the video, that women continue to die needlessly, and yet we can take action to prevent that and to lessen the deaths of women, but to also improve their health. Women, children, and adolescents must be prominent in our agendas to improve health across the world. And so if we can continue with that resolve, we will certainly achieve a number of objectives. Thank you very much for being here.
Thank you, President Ramaphosa, for your leadership and for the keynote address. And it was really touching to hear that when the freedom of your people was achieved, women's sexual and reproductive health and rights were also secured at that time. The two went together, and we thank you for your passionate commitment to these issues and for speaking from the heart. Thank you so much. Now, I would like to invite His Excellency Dr. Ruto, the President of the Republic of Kenya, to come forward and tell us about his vision on how we can accelerate action to end preventable maternal, newborn and child mortality. Dr. Ruto, you have the floor. Thank you.
Thank you very much. Excellencies, distinguished ladies and gentlemen, it is inspiring for me to know that we are all here to actualize our shared aspiration to address missed opportunities in improving the welfare of women, children, and adolescents with urgency and a spirit of partnership. The Sustainable Development Goals and the Global Strategy for Women's, Children's, and Adolescents' Health were launched in 2015. Yet with only 5 years remaining to meet these goals, only 16% of targets are on track, while an overwhelming 84% show limited or no progress. It is deeply concerning that maternal mortality, stillbirths, and neonatal deaths remain critical issues in sub-Saharan Africa and Southern Asia. In 2020, these regions experienced 300,000 maternal deaths, 1.9 million stillbirths, 4.9 million under 5 children's deaths, and 1 million adolescent deaths. Although Kenya has made considerable progress in reducing maternal and under 5 mortality, challenges such as inadequate funding and limited capacity to provide essential services persist. We recognize that only a multi-sectoral approach, including healthcare, education, and community support, can accelerate mortality reduction. Towards this end, It is therefore essential to increase investment, enhance collaboration, and focus on primary healthcare to scale up key interventions like skilled birth attendants, vaccinations, and improved nutrition. Recognizing that only urgent collective action can save millions of lives by 2030, we have pledged to enhance partnerships and establish a dedicated fund for maternal and child health. This fund will help advance progress towards SDGs by improving service delivery and expanding access to essential care. From an economic perspective, keeping people healthy is immensely beneficial. Studies show that every dollar invested in maternal and child health yields $9 in returns through improved health and productivity. Any annual investment of 1.5 billion US dollars could save 35 million lives by 2030 and generate 100 billion in productivity and healthcare savings. We have a singular opportunity to escalate our contributions to global health initiatives and significantly enhance their impact by supporting Africa Health Strategy and KAMA campaign, that's campaign on accelerated reduction of maternal, newborn, and child mortality in Africa as an ideal starting point. It is important to emphasize, however, that investments must be complemented with robust transparency and accountability measures. This is why Kenya supports initiatives like the Africa Peer Review Mechanism and Reproductive Maternal, Newborn, Child, and Adolescent Health Scorecard to track progress and to prevent unnecessary deaths. The return on investment in adolescent health is estimated at between 5 and 10 US dollars spent, with school-based and community-targeted interventions being highly effective. In Kenya, therefore, we are deploying community health promoters to bring vital health information and services directly to communities as part of our commitment to a sustainable and equitable future by securing the health and well-being of all women, children, and adolescents. We have had a robust conversation in Kenya. We had two programs that were running. One, Linda Mama, that was an insurance program to make sure that every mother who is going to give birth, the government of Kenya pays for the prenatal and postnatal services. We have since, under our new universal healthcare program, expanded that to include the child up to 5 years, so that we can take care of that moment in time when children are most vulnerable, between ages 0 and 5. We have also expanded what initially we called Edu Afia, or Education Afia, where we had an insurance program for all our secondary school children. Under our new program, we have expanded that to include every child from primary school to age 18, so that every adolescent has a government paid for insurance program to take care of their health needs. This expansion of the programs that we are undertaking is in partnerships with friends. And I am very happy that in this audience, Professor Senait, who is here, has been working with us and has gone out of her way to pay for some of our women and children in that program. It is a complementary partnership between private and public in making sure that we secure the health of our people. we have every reason to be confident that together, as President Ramaphosa said, we can create the future we envision by prioritizing equity and inclusion in healthcare access, increasing funding, and strengthening our commitment to SDGs. If we can act in unity and without delay, nothing can stop us. And I'm very confident that we will work this together, and you have our solidarity, support, and partnership. I thank you.
Thank you so much, President Ruto, for that strong commitment you expressed, and also for the focus on the primary health care, the skilled birth attendant, the vaccination, the nutrition, the whole package that is so important in achieving these aims. I'm now going to welcome His Excellency President Boakai of the Republic of Liberia to come and speak to us about his vision for putting women, children, and adolescent health and well-being as a top priority on the global agenda. Mr. President.
Your Excellencies, distinguished ladies and gentlemen, it is a privilege to address this critical discussion on the health and well-being of women, children, and adolescents. This dialogue is essential as we work together towards achieving the 2030 Sustainable Development Goals, particularly the SDG 3, which focuses on health and well-being for all. Liberia is fully committed to this endeavor. We have made progress in reducing maternal and child mortality and expanding access to health care, yet challenges remain. Maternal mortality rates are improving, but still unacceptably high, and child mortality persists as a concern, particularly in the rural areas. Additionally, our adolescents face unique health challenges that require targeted responses. Political leadership has been pivotal in our achievements. Through strategic policy initiatives and strong partnerships, we have integrated health priorities into our national development plans. Our focus remains on several key areas. Maternal and child health. We are expanding access to parental and to prenatal and postnatal care, ensuring essential medicines are available, and training healthcare workers to provide high-quality care. Our commitment to reducing maternal and child mortality is steadfast. Adolescent and health and well-being. We are recognizing our adolescents as future of Liberia. We are enhancing sexual and reproductive health education and expanding mental health services to prevent adolescent pregnancies. Universal health coverage. Achieving universal health coverage is fundamental to providing all Liberians with necessary health care. Our Liberia Health Equity Fund is nearing approval, aiming to ensure every citizen can access health services without crippling out-of-pocket fees. Mental health. We are expanding mental health programs and facilities to reach undeserved communities, recognizing the crucial and critical importance of mental well-being of our women. Despite the challenges of limited resources and ongoing global health crisis, we see opportunities to grow through international cooperation. Increased investment in health systems and capacity building will be very vital. Political leadership is crucial for accountability and resource mobilization to meet health-related SDGs. It is our duty to advocate for equitable healthcare access and integrate health priorities into our national agenda. I remain very much committed and I reaffirm Liberia's commitment to achieving health-related SDGs by 2030, especially for women, children, and adolescents. I urge all nations to join us in the shared responsibility to secure the health of future generations. With strong leadership and collaboration, we can ensure every woman, child, and adolescent has the right to health and well-being. Together, we will realize the vision of 2030 agenda. I want to thank you for your attention and dedication to this important cause. Thank you.
Thank you, Mr. President, and also thank you for emphasising the issues for adolescents, an area which the Partnership for Maternal, Newborn and Child Health has put a lot of focus on in recent years. Thank you for your leadership. I would now like to welcome here the Prime Minister of the United Republic of Tanzania, also speaking on improving health and well-being of women, children and adolescents as an aspect of national development. Prime Minister, you have the floor.
Excellencies, heads of state and government who are here, distinguished participants, at the outset, on behalf of Her Excellency Dr. Samia Suluhu Hassan, President of the United Republic of Tanzania, allow me to thank Your Excellency Cyril Ramaphosa, President of the Republic of South Africa, for convening this important event and for your regional and global leadership in maternal, newborn child, and adolescent health. Your Excellencies, last year, you rightly noted that if we secure the health of child and women, we will improve the health of all humanity. Yet, we are far from achieving the Sustainable Development Goal of reducing maternal deaths for 70%, 100,000 by 2030. Alarmingly, about 800 women die daily from preventable causes related to pregnancy and childbirth around the world. This situation compels us to act decisively and prioritize a better future for every child. Excellencies and dear delegates, this meeting is important to agree on actionable steps to accelerate progress in women, children, and adolescents' health. Effective leadership is essential to strengthen health sectors and expand access to primary care. Long-term sustainable funding is critical. Every dollar or cents invested in health yields substantial societal dividends. Additionally, sharing best practice and focusing on data analysis will enhance our collective efforts. Ladies and gentlemen, in Tanzania, Women who will be productive are 47.3% of all women. The latest survey showed that our maternal mortality ratio has declined by 8% between 2026 and 2022. While we have seen improvements in child mortality, the neonatal mortality rate has stagnated. These achievements highlight the importance of leadership, financing, cooperation, and monitoring in meeting of our health goals. Excellencies, heads of states, ladies and gentlemen, with these few remarks on behalf of the government of the United Republic of Tanzania, under the able of leadership of Her Excellency Dr. Samia Suluhu Hassan, Tanzania pledges its support to the global leaders, Network for Women, Children, and Adolescents' Health. Maternal and newborn health is a top priority for us, and we are eager to collaborate with the global leaders to reach the crucial target. Thank you for listening.
Thank you so much, Prime Minister, and please pass our thanks back to the President for the priority she is giving to these issues. I'm now going to call on two ministers. Firstly, Dr. Ibrahima Sy, Minister of Health and Social Action, on behalf of the President of the Republic of Senegal. Minister, you have the floor.
Merci beaucoup. Excellences, honorables, distingués invités. Au nom de son Excellence, Monsieur